Hi, my name is Lindsay Hurlbert, and my population health project is on Native American veterans. So, some historical context to go over before we start the actual project. Um, from the Revolutionary War to the Civil War, Native American troops have served as scouts and auxiliary troops. In World War II, there were approximately 12,000 Native Americans that served. I'm sorry, in World War I, there were approximately 12,000 Native Americans that served. In World War II, there were approximately 44,000 Native Americans that served between the years 1941 and 1945. They served as cryptologists, and they were even Native Alaskan inhabitants that were part of the Alaska Combat Intelligence Detachment Team. In Korea, there were approximately 10,000 Native Americans, and three of which were awarded Medals of Honor. In the Vietnam War, there were approximately 42,000 Native Americans served, and 90% of those 42,000 were volunteers. There were many other wars and operations, such as Grenada, Panama, Somalia, the Gulf War, Operation Enduring Freedom, Operation Iraqi Freedom, and Operation New Dawn, that Native Americans also served in. So, a community description of Native American veterans. Since the American Revolutionary War, so over 200 years, Native Americans have served in the United States services. There are currently 31,000 active duty, reserve, and National Guard servicemen and women. There are currently approximately 133,000 veterans, and 11.7% of those are female. Out of all races and backgrounds, approximately 19.9% of the total served pre 9/11 population were those of Native American descent. Of all female veterans, approximately 1% are of Native American descent. Of all Vietnam War veterans, nearly 34% are of Native American descent. And the median age for Native American veterans is 59. Some community and health disparities. There's currently lower personal incomes that they experience more than any other race. That means that they have to utilize public health systems such as Medicare and Medicaid, as well as Affordable Care Act. The unemployment rate for Native Americans is about 5.3%, which is significantly higher than the 2.3% that is shown for other races. There's also lack of health insurance and health coverage. This accumulates for 5.4% of Native Americans compared to the 2.3% for other races. There's a decreased amount of healthcare eligibility and reimbursement compared to other races, a higher rate of service-related disabilities, almost 10% higher, so 29.8% versus a 20.6% for other races. There's also a high amount of post-traumatic stress disorder, especially those that served in the Vietnam War. There's poorer health outcomes and reduced services in the VA, higher death rates for Native American veterans compared to white veterans, and there's um, higher rates of the following diseases. So stage 4 chronic kidney disease, colon disease, or colon cancer, diabetes, HIV, rectal cancer, obesity, hypertension, and stroke. The biggest disparities are diabetes, obesity, and hypertension for Native Americans. Current trends and future trends. Generally, for the Native American population as a whole, the mortality rate is steadily increasing due to alcohol abuse, diabetes, chronic liver disease, and stroke. Native American populations consistently face higher mortality rates for every single health disparity, except for Alzheimer's disease. But the good news is that with further implementation of primary health programs on reservations, this has helped decrease veteran-specific mortality rates. Um, so increasing the utilization of these specialized programs with the help of caseworkers and nurse practitioners can help decrease the mortality rates and morbidity rates of these Native American veterans. Native American veterans are mostly located in western and southern states, such as California, Oklahoma, Arizona, New Mexico, and Texas. Texas has one of the highest populations of Native American veterans. This accumulates for over 50,000 people. One of the biggest issues in regards to the in regards for the Native American veterans is the Veterans Association itself. The Veterans Association has been accused of not giving a lot of information for qualifications in order for Native Americans to receive these services. So, proof of Native American lineage and proof that they actually served in wars is crucial in order to receive services from them. There's also poor quality assistance with VA personnel, poor communication from providers, according to 48% of surveyed minorities. There's also lack of program utilization and funding that's given to the VA for Native American specific treatments. There's also a really large caseloads for people like caseworkers and providers that do have the opportunity to work with these Native Americans, but the caseload is just so high that there's not a lot of time for them to work one-on-one with these patients. There's also a lack of VA home-based or telemedicine care for those in rural reservations. I have read that some of these reservations are currently 2+ hours away from their nearest Veterans Association facility, which can really be detrimental and can just force these Native American veterans to just not get the care that they need. Some interventions that I find important is a focus on whole health initiative. The VA medical program is a program that is looking to extend medical centers onto these reservations. Hiring a more diverse staff helps build trust and faith for all cultures. Offering in-home and telemedicine interventions will help decrease the amount of travel and unnecessary travel that both the providers, case managers, and the Native American veterans they will have to do. Increasing funding for program expansion will definitely help. Increasing and sustaining patient outreach, such as passing out flyers and providing word of mouth referrals. Working with tribes and their leaders in order to respect and accept different cultures. Focus on health equity rather than equality. Include the IHS, which is the Indian Health Services, to expand healthcare eligibility. In conclusion, about 75% of minority patients in general believe it is the VA's responsibility to promote quality of care for all minority patients. Approximately 69% of surveyed minority patients do not believe they are receiving quality care due to the color of their skin. The Empower Project also develops narratives for providers that decrease bias, and I highly recommend everyone to look at the National Native American Veterans Memorial that will be in Washington, D.C. in late 2020. Thank you so much.